Thousands and thousands of people are getting diagnosed with type 2 diabetes every single day, getting told that it's a hopeless disease, you'll always be stuck with a high blood sugar, always be stuck with the symptoms, and that there's no way out. But what if I told you that your body's not broken, but it's just overloaded? In today's video, we're gonna be discovering how you can fight against type 2 diabetes by understanding what it is and actually knowing the solutions for it. The first thing you need to understand is that type 2 diabetes is not just about high blood sugar. It's actually from a condition called insulin resistance. Whenever you eat food, your body releases a hormone called insulin. So think about eating a cheeseburger, hamburger, fries, whatever you eat, even healthy foods as well, there's going to be sugar inside the foods that you eat. That sugar is going to go inside of your bloodstream. Now, typically, once the sugar is out of your bloodstream, it goes to the muscles in your body, allowing your body to be able to lower your blood sugar. But for some reason, and those that have type 2 diabetes, their body is not responding to the insulin. It's not responding to the hormone that pushes their blood sugar down. Now, this has to be distinguished between type 1 diabetes and type 2 diabetes. Type 1 diabetes is the one where the body is not even producing insulin or not producing insulin in enough way to where the body notices and is able to push down the blood sugar. But in type 2 diabetes, the body is producing insulin and it's producing enough insulin. However, the body is just not responding to the insulin. So because the body is not responding to the insulin, the blood sugar stays high, leading to the negative side effects, like always feeling tired, and also admittedly, sometimes limbs falling off as well. So then if insulin is the problem, or rather the lack of listening to the insulin is the problem, then what causes the body to not listen to the insulin? This is the thing. Being someone that is sedentary, always sitting down, not doing a lot of physical movement, always eating a lot of high sugar foods. These things in conjunction with ultimately having a lot of visceral fat and high body fat lead to your body not listening to the signal of lowering down the blood sugar. Now, we need to understand about body fat. Body fat is not just storage, but it can actually lead to inflammation. And then inflammation leads to insulin resistance. And insulin resistance leads to type 2 diabetes. It's a chain reaction of things that's been happening over the course of years. Now, understanding this, we can now see why just by lowering the sugar intake is not going to be the only solution when it comes to type 2 diabetes. You need to be implementing many steps in order to get rid of type 2 diabetes. The first part of the solution for getting rid of type 2 diabetes is understanding nutrition. Food is the information for your metabolism. A couple of things we need to prioritize though. We need to prioritize our fiber foods like your vegetables. Next thing is going to be lean meats like your chicken. And then last thing is going to be fruits. If eaten in a certain way, fruits can help reduce type 2 diabetes as well. And then of course, your fats. Those are what we need to include more. What we need to reduce is going to be your sweets, your processed foods, your high carb foods, your sugars, especially those that are refined. Eating foods in a certain way also matters as well. First thing you want to do is going to be eating your fibers, like your vegetables. Making sure you're eating an abundance of vegetables is going to be the majority of your plate. Eating that first, then you're going to eat your meats. Your meats are going to be eaten second. Chicken, steak, fish. These are going to be eaten, first thing within the meal. And then after that, you can have your carbs if you're going to have carbs, which is going to be your rice and ultimately sometimes fruits as well. These are going to be good eaten in this direction as the order in which you eat your foods, especially going from the protein, fats to carbs, is going to be very important compared to just eating the carbs first and then eat the protein and fiber last. So order of food matters. Here's just an example of the type of plate you can have. Plate, half of it vegetables consisting of broccoli, lettuce, Brussels sprouts, kale, spinach. That's going to be taking up at least half of your plate, if not more. Next thing is going to be a small portion of rice, about 10 to 20% of your plate, and then also including your meats as well as like the salmon, the salmon or the fish, and even chicken as well is going to be that low protein. But if you have to take out anything, you can eliminate the carb and just keep the meat and the vegetables and have that together. It's going to be a really good meal. Now, when it comes to eating your food, you don't just want to eat your food, right? We are trying to get rid of a disease. So the next thing we want to do is track how our body responds to the foods that we eat. Yes, there's going to be foods that are going to be generally safe for everybody, but you want to see how your body specifically responds to the food at the time that you're eating in it and the amount that you're eating the food as well. Knowing how your body responds gives you the best chance of knowing what foods to continue eating or knowing the foods that you should stop eating as well. It's not just about diet, but it's also about blood sugar control and response. Number two, the next best way that we can use to fight against type 2 diabetes is going to be exercise. Exercise is really great for lowering blood sugar and also giving your body a better response to sugar after you eat food. The reason why it's so good is because your muscles act as a glucose sponge, which means that by building more muscle, which comes by the resistance training type of exercise, your body has a lot more places to put the excess sugar that's within your bloodstream. It goes from your bloodstream into your muscles. And by exercising, you're opening up the cell to receive that sugar. And now your body feels more energized to continue a workout and ultimately to build muscle, which will lower your risk of type 2 diabetes and help you fight against the high blood sugar and lower your A1C. Now, yes, I did just mention resistance training, but you want to do all forms of training, not just resistance training. You want to do resistance training, walking, cycling, yoga, jogging, anything that you can do consistently is going to help. However, resistance training has been shown to give your body a really good glucose response as it gives your body more places to put the glucose. Please, when it comes to working out, please understand you don't need a perfect workout. You need something that you can do consistently. And if you can do something consistently, that's going to build muscle as well as move your body around, and it's going to get you to sweat, you'll be on the right track to using exercise to get rid of type 2 diabetes. Now, the timing of food can affect how your body responds to the sugar. The timing of your exercise matters as well. Yes, of course, ideally you want to be as moving around as possible. You want to be as active as possible. But if you have to choose one time to work out, it's best to do some kind of exercise after you have finished eating a meal. The reason why is because the sugar within your food is going to go into your bloodstream. And once it's in your bloodstream, to get it out of your bloodstream, your body will be a lot more sensitive to the insulin once you start eating and exercising right after as well. This will lower your blood sugar spike compared to what it would be if you did not exercise. Now, if you're eating right and you're also moving around actively often, then you're going to lose weight. Studies have shown that by losing 10% of your body weight, 5 to 10% of your body weight, it can also reverse type 2 diabetes and also make you more insulin sensitive as well, which means that your body is now more responsive to the hormone that causes your blood sugar to go down, which is the whole point of the type 2 diabetes. We want to actually make your body more insulin sensitive. And by doing these two things, it's going to give you the best chance at actually reversing the disease. Number 4, recovery. Go to sleep. If you're not getting enough sleep, your body's going to be more stressed. And as mentioned before, if you are stressed, you will increase the hormone called cortisol. Cortisol increases inflammation, and cortisol also makes your body more insulin resistant. And because your body's more insulin resistant, getting rid of type 2 diabetes and lowering your blood sugar, lowering your A1C, it's gonna be very, very difficult. So getting a good amount of sleep and going into low stress environments as well will give you the best chance at reversing type 2 diabetes. So now here are the top 3 mistakes that people make when it comes to reversing type 2 diabetes. Number 1 is only focusing on the sugar. If you only focus on the sugar, you're missing the whole point. The issue is insulin resistance. Number 2, extreme dieting. If you diet extremely, yes, you may see some changes in a little bit, but this will lead to burnout actually, and it will not last a long time. That leads us to the next point, which is number 3, inconsistency. Even if you're someone that's working out, even if you're someone that's eating better, getting enough sleep, if you're doing everything right, but you only do it for a day or two, you're not gonna see any changes. You need to be consistent, doing well, at least for 3 months to see a change in your A1C. Now, how far your A1C might drop is determined by a lot of factors, but you will see a drop after 3 months of doing proper eating, being more active, and proper sleep if you do these consistently. The daily plan you're going to follow is going to be focusing on eating whole foods for breakfast, lunch, and dinner. Eating foods in the order of protein, fats, carbs, in that order. Number 2, your next thing you're gonna be doing is making sure that you get at least 30 minutes of exercise, whether you're walking for 30 minutes, whether you're jogging for 30 minutes, whether you're doing cardio, aerobics, or strength training for 30 minutes. Do 30 minutes of some kind of training after you eat food. It has to be after you eat food and not before, as doing it before will significantly drop your blood sugar, which sounds good, but in the long run, it will actually be way more dangerous than having high blood sugar. And then number 3, you're going to monitor and make sure that you get enough sleep. Sleep is very, very important, as recovery is going to be the number 1 thing that lowers your stress levels. Do not eat anything before you go to sleep. About 2 to 3 hours before going to sleep, make sure you do not eat anything. It'll mess up your metabolism, it will mess up your blood sugar levels, and it will lead to very weird results in the morning. Stay away from food before going to sleep. And lastly, I want to end off this video by letting you know that if you have been diagnosed with type 2 diabetes or are pre-diabetic, that it is not a life sentence and that there is still plenty of hope. Being diagnosed with type 2 diabetes is a wake-up call. Yes, you have seen your A1C go up and your doctor has given you the diagnosis, but there is still things that you can do, and together we can put together a plan to fight against the disease and to get you back where you want to be. My name is Khalil. I'm an exercise scientist, and I help people understand and learn how to fight against type 2 diabetes using diet and exercise. I can follow for more.